Lassa fever, a viral hemorrhagic fever, was first discovered in 1969 after an outbreak occurred in the town of Lassa in Borno State, Nigeria. The disease is caused by the Lassa virus, which is a member of the Arenavirinae family. The virus was initially isolated from the blood of a missionary nurse who had become infected during the outbreak. Since its discovery, Lassa fever has been identified in various West African countries, with Nigeria, Sierra Leone, Guinea, and Liberia reporting the highest number of cases. The primary reservoir for the Lassa virus is the mastomys rat, which is native to the region. Humans can contract the virus through contact with the rat's urine, feces, or contaminated food and household items. Transmission between humans can also occur through direct contact with infected bodily fluids. The path of infection for Lassa fever typically involves the following steps. Reservoir. The primary reservoir for the Lassa virus is the mastomys rat, a common rodent species found in West Africa. These rats can carry the virus without showing symptoms. Transmission to humans. Humans can become infected with Lassa virus through direct contact with infected rats or their excreta, urine and feces. This often occurs when people unknowingly consume contaminated food or water, or when they come into contact with contaminated surfaces, materials, or objects. Human-to-human transmission. Lassa virus can also be transmitted from one person to another through direct contact with infected bodily fluids, such as blood, urine, saliva, semen, or vomit. This can happen during caregiving, sexual contact, or through contact with contaminated surfaces. The virus can also spread in healthcare settings if proper infection control measures are not in place, such as the use of personal protective equipment, PPE, and proper disposal of contaminated materials. Incubation period. After exposure to the Lassa virus, there is an incubation period of 6 to 21 days before symptoms appear. Symptoms of Lassa fever can vary widely, ranging from mild to severe. In some cases, infected individuals may be asymptomatic or experience only mild symptoms. However, when symptoms do occur, they typically include fever. A sudden onset of high fever is often the first sign of Lassa fever. Headache. Persistent and severe headaches are common. Malaise. General feelings of weakness, discomfort, and fatigue are typical. Sore throat. A sore throat, often accompanied by difficulty swallowing, can occur in the early stages of the illness. Muscle and joint pain. Infected individuals may experience pain and aches in their muscles and joints. Abdominal pain. Pain in the abdomen and gastrointestinal issues, such as nausea and vomiting, can be present. Diarrhea. Some patients may experience diarrhea, which can contribute to dehydration. Chest pain. Chest pain and cough can occur, especially in cases with respiratory involvement. As the disease progresses, more severe symptoms may develop in some cases, including hemorrhagic symptoms. Uncontrolled bleeding from the gums, nose, or internal organs can occur in severe cases. This can lead to blood in vomit, urine, or feces. Neurological symptoms. Seizures, disorientation, and altered mental status may develop as the infection affects the central nervous system. Shock and organ failure. Severe Lassa fever cases can lead to circulatory shock and multi-organ failure, which can be fatal. It is important to note that Lassa fever shares many symptoms with other tropical diseases, such as malaria and typhoid fever. Therefore, laboratory testing is necessary for a definitive diagnosis. Early diagnosis and treatment are crucial to improving the chances of survival and reducing the risk of complications. Treatment for Lassa fever mainly involves supportive care and antiviral medication. There is no specific vaccine available for Lassa fever, so early diagnosis and treatment are essential for improving patient outcomes. The treatment includes antiviral medication. Ribavirin, an antiviral drug, has been shown to be effective in treating Lassa fever when administered early in the course of the illness. Intravenous ribavirin is typically used for severe cases, while oral ribavirin may be used for milder cases. However, ribavirin is not without side effects, and its use should be carefully considered based on the severity of the disease and potential risks. Supportive care. Patients with Lassa fever often require supportive care to manage symptoms and complications. This can include Fluid and electrolyte management. Maintaining proper hydration and balancing electrolytes is important to prevent complications, such as dehydration and shock. Pain management. Analgesics may be given to alleviate pain and discomfort. Oxygen therapy. Supplemental oxygen may be administered to support patients with respiratory difficulties. Blood transfusions. In cases of severe hemorrhagic symptoms or anemia, blood transfusions may be necessary. Treatment of secondary infections. Bacterial infections can arise as complications of Lassa fever, so antibiotics may be prescribed to address these issues. Organ support. In severe cases, patients may require support for failing organs, such as dialysis for kidney failure or mechanical ventilation for respiratory failure. Infection control measures. To prevent the spread of Lassa fever, it is crucial to implement strict infection control measures, especially in healthcare settings. This includes using personal protective equipment, PPE, like gloves, masks, and gowns, as well as proper disposal of contaminated materials and sterilization of medical equipment. Monitoring and follow-up. After recovery, patients should be monitored for potential long-term complications, such as hearing loss. Regular follow-up care may be necessary to address any ongoing health issues. Early treatment and supportive care can significantly improve survival rates and reduce the risk of severe complications from Lassa fever. However, prevention remains the best strategy to control the spread of this disease. Preventing Lassa fever primarily involves reducing the risk of exposure to the virus and implementing proper hygiene and sanitation practices. Here are some key preventive measures. Rodent control. Since mastomys rats are the primary reservoir for the Lassa virus, controlling rodent populations and limiting contact with them is essential. This can be achieved by a. Storing food in rodent-proof containers and keeping living areas clean. b. Properly disposing of garbage to avoid attracting rodents. c. Sealing holes and gaps in homes to prevent rodents from entering. d. Using traps or other pest control methods to manage rodent populations. Food hygiene. Ensure that food is properly stored, prepared, and cooked to minimize the risk of contamination by rodent excreta. Personal hygiene. Washing hands regularly with soap and water, especially before eating and after handling animals, can help prevent the spread of the virus. Protective measures. Using gloves, masks, and other personal protective equipment, PPE, when handling sick individuals, corpses, or materials contaminated with the Lassa virus can help prevent transmission. Infection control in healthcare settings. Strict infection control measures should be implemented in hospitals and clinics to prevent the spread of Lassa fever. This includes a. Isolating patients with suspected or confirmed Lassa fever. b. Using appropriate PPE, such as gloves, masks, and gowns. c. Sterilizing medical equipment and properly disposing of contaminated materials. d. Educating healthcare workers about the disease and how to prevent its transmission. Public awareness. Raising public awareness about Lassa fever, its symptoms, and preventive measures can help communities recognize and respond to potential outbreaks. Surveillance and early detection. Monitoring for Lassa fever cases, especially in high-risk areas, can help detect outbreaks early and facilitate a rapid response. Travel precautions. Travelers to areas with known Lassa fever risk should take precautions to avoid contact with rodents, practice good hygiene, and seek medical attention if they develop symptoms consistent with the disease. By implementing these preventive measures, the risk of Lassa fever infection can be reduced, ultimately helping to control the spread of this potentially deadly disease.